Hello, and welcome to the Physicians Evaluation Network orientation for physicians who are approving a patient's use of cannabis under a state-approved medical marijuana program. My name is Rachel Miller. I will be the presenter for this orientation. The Physicians Evaluation Network acknowledges the following individuals who have contributed to the development of the Penn orientation: Dr. Roger Barnes, Dr. Rolando Tringali, Dr. David Delaney, Liz McDuffie, Director of the Medical Cannabis Caregivers Institute, and Janet Collins, Attorney at Law and founder of Physicians Evaluation Network. This orientation was developed for physicians who may be interested in providing a medical cannabis evaluation to determine if the use of cannabis may be the appropriate option. As a newly emerging treatment modality, increasing numbers of patients are requesting an evaluation for the medicinal use of cannabis. The following 19 states and the District of Columbia have enacted legislation related to the medicinal use of cannabis. These states include Alaska, Arizona, California, Colorado, Connecticut, Delaware, Hawaii, Maine, Maryland, Massachusetts, Michigan, Montana, Nevada, New Jersey, New Mexico, Oregon, Rhode Island, Vermont, and Washington. State and federal law uphold any physician's constitutional right to approve or recommend a patient's use of cannabis. However, there are still potential risks, liabilities, and problems that can easily be avoided with the information presented in this orientation. Any questions regarding the information presented in this orientation may be referred to Janet Collins at 855-758-6944 or 781-885-3459. The email for Janet Collins is jmc@accesspenn.com. Let's begin. To qualify to participate in a state-approved medical marijuana program, a licensed physician in good standing with their state medical licensing board or the state osteopathic medical licensing board must make the approval or recommendation for the patient to use medical cannabis. When considering the words approval or recommendation, most physicians prefer to approve rather than recommend the patient's use of cannabis. Let me emphasize that only a licensed physician may legally approve or recommend a patient's use of cannabis. The approval or recommendation is illegal under both state and federal law if the approval or recommendation is not made directly by a licensed physician. Please note that the physician is not required to be the patient's primary care physician in order to approve or recommend a patient's use of cannabis. Any licensed physician may make a medical cannabis approval or recommendation. In addition, the approval or recommendation must be renewed annually in order for the patient to continue participation in the medical marijuana program. It is important for physicians to have the information that will enable them to avoid potential problems related to a medical cannabis evaluation. These potential problems include medical board investigation and litigation, federal sanction, third-party liability, illegal management, and fee splitting. So let's start with medical board guidelines for a compliant approval or recommendation. Medical board investigations and litigations of physicians generally relate to the physician's failure to establish a bona fide physician-patient relationship when approving or recommending a patient's use of cannabis. For example, the physician failed to perform a good faith exam, or the physician made an approval with no medical record documenting the patient's medical condition. Let's quickly review the medical board guidelines for establishing a bona fide physician-patient relationship. First, we have the patient's medical history as shown on the patient's medical history questionnaire, the good faith exam, a treatment plan with objectives, a discussion of risks and side effects, record keeping that supports the approval or recommendation, consultation as necessary, and a periodic review at least every 12 months. Since most physicians who approve the use of cannabis are not the primary care physician, the patient is asked to provide a copy of their medical record documenting the medical condition for which the patient is requesting cannabis as a treatment option. Physicians should avoid providing a temporary approval that gives the patient time to bring in his or her medical record. Here we have the forms and documents required for a medical cannabis evaluation. Form 1 is the patient's medical history questionnaire. Form 2 is the exam notes. Form 3 is the treatment plan. Form 4 is the risks and side effects, informed consent, and release of liability. Form 4 is an important document for the physician's third-party liability protection. Form 5 is the physician's written approval or recommendation. Form 6 is the release of medical record that is needed in order for the physician to confirm the authenticity of the approval or recommendation. Verification of the authenticity of the patient's approval is required before the cannabis provider is able to provide cannabis to a patient. All of these forms and documents are provided by Penn at no charge. The Penn 24/7 verification service relieves the physician from having to respond to calls regarding verification of the patient's approval. Most state-approved medical marijuana programs include a state registry for patients participating in the program. The state registry for the medical marijuana program serves as a third-party verification that the physician who is approving the patient's use of cannabis has a valid license with the state medical board and the patient's approval or recommendation is authentic. The state registry provides a definitive way for law enforcement officers to verify that the patient has an approval that is valid. Until the state's registry is established and operational, Penn provides a 24/7 verification service for physicians who participate in the network. There are other considerations regarding cannabis approvals. First, let's talk about serious medical conditions. Under a state-approved medical marijuana program, the serious medical conditions for which cannabis may be an appropriate treatment option may include any debilitating condition that substantially limits the ability of the person to conduct one or more major life activities. Under this definition, insomnia or anxiety attacks may qualify as a serious medical condition. When discussing the serious medical conditions, we need to turn our attention to the two court cases that upheld the physician's constitutional right to approve or recommend cannabis as a treatment option: Conant v. Walters and Conant v. McCaffrey. These court cases specifically name the serious medical conditions for which cannabis may be an appropriate treatment option. The California Medical Association urges physicians to consider that constitutional protection may not be available if the approval or recommendation is made for a medical condition that is not named in Conant v. Walters and Conant v. McCaffrey. Let's take a look at the serious medical conditions named in these court cases. Severe nausea, commonly associated with HIV, AIDS, and cancer. Wasting syndrome, associated with HIV, AIDS, and cancer. Glaucoma. Seizures or muscle spasms associated with a chronic debilitating condition commonly associated with epilepsy, multiple sclerosis, paraplegia, quadriplegia, and hemiplegia. Severe chronic pain commonly associated with diagnosed paraplegia, quadriplegia, hemiplegia, HIV, AIDS, metastasized cancers, and cervical disc disease. It is the physician's decision to approve or recommend a patient's use of cannabis based on the more liberal definition of serious medical conditions as defined under the state-approved medical marijuana program, or on the definition of serious medical conditions as named in Conant v. Walters and Conant v. McCaffrey. There are other considerations. The patient may not have a primary care physician or medical record. The physician is advised to avoid making an approval of a patient's use of cannabis without documentation of the medical condition for which the physician is approving the use of cannabis. Patients with mental health conditions require special consideration. The patient may be using prescribed psychoactive medication. The primary care physician for the patient's mental health care should be consulted before an approval for the use of cannabis is made. Let's address minors. Under federal law, individuals under 21 are considered a minor. State-approved medical marijuana programs allow individuals under 18 years of age to participate in the program with a parent's approval. There are growing numbers of parents with children who suffer from symptoms of severe autism who are reporting that their child's symptoms are being successfully treated with non-psychoactive cannabis-based tinctures and edibles. Now we will look at federal law and how it relates to a physician's approval or recommendation. Although federal law upholds a physician's right to approve or recommend cannabis, very strict limitations are placed on what the physician can and cannot say in making an approval or recommendation. The physician may not prescribe cannabis or recommend a dosage. The physician is only permitted to approve or recommend. The physician is not allowed to provide information regarding where the patient may obtain cannabis. Doing so would be considered aiding and abetting under federal law. The physician may not discuss any details on how the cannabis may be prepared. For example, how a cannabis tincture is prepared. Doing so would be considered aiding and abetting. The physician is also advised to inform his or her employees regarding these restrictions on providing information to the patient regarding cannabis. So what can the physician say to the patient? The physician is free to discuss risks and side effects, research data, and studies, including anecdotal information. Since the physician cannot tell the patient where he or she may obtain cannabis, what should the physician say when the patient asks the question, "How do I obtain cannabis?" The physician should inform the patient that it is federally illegal for any physician to provide information regarding where cannabis may be obtained. The physician may suggest online searches under keywords like medical cannabis or medical marijuana, for example. These online searches will generally provide information regarding cannabis providers under the state's medical marijuana program. Penn provides a patient brochure that explains what constitutes a legitimate approval of patients' use of cannabis. The brochure is available to network physicians and patients at no charge. The next topic is fee splitting. The difference between legal versus illegal fee splitting is very simple. Fee splitting between or among licensed physicians is legal. It is illegal for the physician to split fees with any individual who is not a licensed physician. This brings us to the cost for the patient's medical cannabis evaluation and the annual renewal that is required in order to continue participation in the program. Evaluation fees generally range from $350 to $75. Physicians generally provide a discount for the required annual renewal. With regard to the physician's professional liability insurance, most medical insurance carriers will cover medical cannabis approvals and recommendations. If you have any questions or comments regarding the material presented in the Penn orientation, please contact Janet Collins at 855-758-6944 or 781-885-3459 or email jmc@accesspenn.com. Penn invites physicians to visit the Penn website, accesspenn.com, to learn about the state-approved medical marijuana program and other Penn resources. Thank you for attending the Penn orientation. At this time, I would like to present a 3-minute video that demonstrates the electronic medical record platform developed by the Medical Cannabis Caregivers Institute for the Physicians Evaluation Network.
Welcome to the video